Hi, I'm Jade Hubner, and you're watching Joburg Today.
The return to level 4 of the national lockdown has reignited fears in various industries, like the alcohol and restaurant sector, long-distance traveling, gyms, and social or political gatherings. But most of all, it has forced us to reevaluate our health and hygiene when it comes to masks and other related illnesses.
The technique and how we actually wear our masks, and I think the type of mask that we're wearing, you'll find that a lot of people close their masks off here, but the mask is also coming and covering right down under the chin there. So there's no room for air to actually go in, for the nose to actually get enough breath when you're breathing in. So you'll find that mouth breathing becomes an issue. But also the thickness of the masks has played a huge role in terms of, so a lot of people wear cloth masks, it's reusable, it's cost-effective, but the cloth masks are not as breathable fabrics for us to be wearing for extended periods during the day. So you'll find that a lot of people start thinking that the masks have brought in the problems of now I experience more cavities or now my gums are bleeding, but it's all these sort of interconnected effects of the mouth being dry because of the mouth breathing, because we wear masks. So it's not a direct cause. The masks are not a direct cause of the problems that we're facing at the moment, but they definitely have contributed to the oral cavity obviously experiencing all these different situations.
Deborah offered some solutions.
When you're wearing your mask, I always encourage patients to use sugar-free gum that they can chew, because that actually stimulates the salivary flow in the mouth, that sort of hydrates the mouth at the same time, and sort of avoids or takes the patient away from experiencing dryness of the mouth. So sugar-free gum, consistently sipping on water throughout the day, just to keep your mouth hydrated, that helps a lot with the dryness of the mouth.
Medical experts have also warned that we should pay extra attention to serious illnesses like hypertension and pneumonia, which could potentially exacerbate COVID-19.
Most of the people who have died from the COVID-19 pandemic have died as a result of the pneumonias that they developed following them getting infected by COVID, SARS-CoV-2 or the COVID-19 germ. All right. So some of these germs. So if it is COVID-19 and it's a virus, there is no cure for it. So therefore, some of the pneumonias don't have a specific cure like COVID-19. All right. In fact, all viruses that cause pneumonia, there is no specific treatment for it.
It appears quite surprisingly that hypertension across all ages in South Africa is associated with increased severity of disease and death from COVID-19. And this is quite surprising. It seems to even outweigh the risk associated with HIV/AIDS. And it appears that COVID-19 is not just affecting the lungs, it seems to affect the vascular system, and that's where hypertension affects the vascular system. Now, another problem is that a couple of journals published opinions that some forms of treatment for hypertension were predisposing people to severe COVID-19. These were called ACE inhibitors or angiotensin receptor blockers, and suggesting people stop their treatment. And it was just based on theory.